Welcome to The Explainer. One of the toughest nuts to crack in healthcare is getting those patient experience scores up. So today, we're going to break down a really powerful, super practical tool that can help: nurse scripting.
If you're in healthcare, you know exactly what I'm talking about, right? You and your team are giving it your all, providing incredible care. But some of those key patient experience scores just won't budge. Maybe patients feel a little lost, a little unprepared, and you can see it right there in the data.
So, in this explainer, we're going to zoom in, get really laser focused on two of the big ones, two critical SHAP metrics that always seem to affect those scores: communication with nurses and discharge information. And I'm going to show you how scripting can make a huge difference in both areas.
All right, so what is this tool? Let's get into it. The solution we're talking about is a structured approach called nurse scripting. And look, let's get one thing straight. This is not about turning nurses into robots reading from a page. It's about creating a solid framework for high-quality, consistent care every single time.
So what exactly is it? Well, you can think of nurse scripting as standardized, intentional communication. The whole point is to make sure every single patient interaction is consistent, totally clear, and most importantly, safe. It's really about taking those proven best practices, the things we know work, and making them reliable, everyday habits.
And what's so cool here is how these four things, consistent, clear, safe, and patient-centered, all work together. You see, when communication is consistent, you cut down on the variability in care. When it's clear, you help prevent dangerous misunderstandings. It's a pretty simple formula, but it leads to much safer and way more patient-centered communication. Okay, theory is great, but let's see how this actually works in the real world. First up, we're going to tackle that communication with nurses metric head-on.
This right here, this is the exact survey question we're trying to solve. And it really gets to the heart of the patient experience, doesn't it? It's not just, did they talk to me? It's, did they explain things in a way I could actually understand?
And here's the answer: a super simple, totally actionable script. Before giving any medication, the nurse just says the name, explains what it's for, and, this is key, pauses for questions. It takes, 10 seconds? But it is so incredibly powerful.
And check out the impact here. This is so much more than just being nice. This simple script actively cuts down on medication errors because it pulls the patient into the verification process. It literally empowers them, which in turn boosts their understanding and helps them stick to their care plan. Okay, on to our second big target: discharge information. This is such a high-risk moment. Any confusion here can lead to some really serious problems once a patient gets home.
And once again, the survey question itself points to a huge source of patient anxiety. Think about it. A patient might sit there and nod, saying, yes, I understand. But do they really get it? Do they know what to do or what symptoms to watch for when they're suddenly on their own?
Well, the solution is a game changer. It's a proven technique called the teach-back method, and it's all wrapped up in this one simple question. This is not a test for the patient. It's just a check for understanding. It brilliantly shifts the focus from, did I do a good job explaining, to the only thing that matters: did my patient understand?
And here's the crucial part. This teach-back script confirms that the patient actually gets it, in a way that just asking, do you have any questions, never, ever will. This one single action is directly tied to preventing hospital readmissions. Why? Because it makes sure patients truly, genuinely understand what they need to do.
Okay, so let's zoom out for a second. We've looked at two very specific, small scripts. But how do these little changes add up to big, system-wide improvements in patient safety?
Well, it's all about the ripple effect. It's like a chain reaction. You start with consistent scripting. That consistency immediately reduces variability in how care is delivered. When there's less variability, you naturally prevent more errors. And the final amazing outcome? You get stronger, safer communication for everyone: the care team and the patient.